Well, thank you so much for being here, and thanks for inviting me in. It's wonderful to be here in Ohio. We just spent a week touring Virginia, and then I'm here for 4 days moving through Ohio. How many people have heard of Barbara Wagner, her story? Not very many, a couple. Barbara was a 64-year-old gal that lived in Oregon, and she didn't have health insurance, so she fell to something called the Oregon Health Plan. Well, she developed recurrent lung cancer, and she went to see her oncologist, and he recommended treatment with Tarceva, new chemotherapy. Well, she went to get her medication, her treatment. Instead, she got a letter from the state of Oregon. You see, they had run short on money. They had to start making a decision on who was going to get what treatment. So in this letter, they stated that they would not be able to pay for chemotherapy. However, they were willing to pay for either hospice or for physician-assisted suicide. Yeah, this is a true story from 2008. And it's pretty amazing. There's a reporter that went to talk to her, and she was holding her dog and looking like she was going to go take the dog for a walk or go bake cookies. She's a pretty viable 64-year-old gal. And she says, I'm not ready. I'm not ready to die. She said, I can't believe they're willing to pay for me to die, but not willing to pay for me to live. And government compassion sounds so noble. But in the end, whoever pays holds the power to choose. Essentially, when the state of Oregon ran short on money, they replaced her chance to live with a choice of how to die. Actually, for me, this began, probably 15 years ago, in terms of my interest in the future of healthcare. Back when I was in medical training in internal medicine in New York, I read a book by Peter Singer. He's the chair of bioethics at Princeton. In that book, he struggles with the rising cost of healthcare, and he's trying to find ways to start bring down our cost of medicine. One of the solutions he proposes is that we change the definition of human life, so that humans are, quote, fully human until the 5th week of age. So if an infant is born with a disability, we can have them put to sleep. So we don't have these kids with disabilities that consume so much of medical resources. And then he suggests we can take that money and invest it in kids that are much more gifted. And that makes for, he argues, much more effective and efficient practice of medicine. So I was sort of rebutting him, because I, of course, think that's an outrageous idea. So I was asking the question, how did America reach a place in her history where a leading bioethicist at Princeton could seriously propose infanticide? This is after birth. This isn't abortion. This is killing kids after birth if they have a severe disability. How could a leading bioethicist seriously consider infanticide as a serious alternative or means to reduce the cost of health care? So I went back and read some 50 or 60,000 pages of history and philosophy, and I discovered over the course of time there's really been two choices for physicians, really two choices for culture in terms of the physician's role in culture, which leaves sort of two choices for patients. And we can either follow Plato, where he suggests the physician's role is to look out for sort of the well-being of the collective, the financial interest of the state. So the physician treats those that are young, that are productive, that are moving society forward, and ignores those that are a burden on society, the weak and the infirm. Or else we could follow Hippocrates, where the individual physician sees that human life is a gift from God, that each patient, each person holds intrinsic dignity. And that's really the path that Western medicine has followed for some 2,000 years. And that's really the choice as Americans decide about what to do with the coming health care. The Patient Protection and Affordable Care Act was supposed to help all these uninsured, but the way they accomplished it was cutting care for seniors. How many people here have heard of the IPAB, IPAB? It's the Independent Payment Advisory Board. It's a 15-member panel, this new healthcare legislation, sets up, it is tasked to specifically cut Medicare for seniors. And just to quote a bit from the bill, quote, purpose. It is the purpose of this board to reduce the per capita rate of growth of Medicare spending. So there's 15 unelected, unaccountable individuals that have now been established through this legislation, tasked to cut Medicare spending for seniors. And they're above congressional oversight, above executive oversight, and above judicial oversight. So the United States, under this legislation, now has 15 people tasked to cut Medicare spending for seniors. And when I look at the IPAB, and I think back of the writings of Plato, and of Ezekiel Emanuel, and of Nietzsche, and I won't go, tonight I'll be giving a lecture, it's about 45 minutes, to cover this whole history as I lay out this thought. But essentially, this bill has chosen to devalue human life, where now the people that are going to get the most of the medical care will be the young and the strong and the productive, those that are moving society forward. This legislation views as the infirm, the weak, the sick, unfortunately the elderly, as a burden on society. So my group, Physicians for Reform, and groups such as 60 Plus, are trying to reverse that by helping educate people like yourselves so that we, the people, in November can finally take the country back and get us on a patient-centered, fiscally responsible road towards healthcare reform. Absolutely, the healthcare system needs fixing. I'm still a working physician, and I deal with it virtually every day. But there are much, much better choices out there than the Patient Protection and Affordable Care Act. So I'll be giving a talk tonight. It's going to be in Perrysburg, Ohio, at the Bethel Assembly of God Church. There's little flyers out on the table. Those of you that be interested in coming, I'll be giving about a 45-minute talk and then about 45 minutes of questions and answers to help you understand what this legislation is about. But the end of the story is in November. Get to the polls, vote your conscience, find politicians that are going to be looking out for seniors and not viewing seniors as an expendable item to where they can shift that money to acquire new votes. So find a friend, get to the polls, find somebody that's not your friend, and get to the polls. So that's really what this is about, because we, the people, have to find elected leaders that are willing to look out for us and that value human life. So thank you so much for your time. I wish you the best. God bless you, and God bless America.